Hello, everyone. Finally live. At the real Gerald headline, Andre, we're here. Hi there. Nice to meet you. So, I'm here today to go over some questions that were posted to us. Um, the first one I'm going to explain is what exactly is awake lipo? How is it different from laser lipo? How long does it take? And what's the recovery downtime like? Okay, great questions. So, liposuction is essentially fat removal using a suction device. Um, we use things called a cannula, which looks like a rod. They come in different shapes, different size diameters, and we make in small incisions and we go under your skin and we suck out the fat. The analogy that I use for patients is um, think about the fat is air and you're popping a tire and letting the air out. It doesn't address the skin, but it does address fat. It's different from laser lipo because laser lipo uses a laser. I'm not a huge fan of laser lipo because I've done a lot of liposuction revision and I don't like the amount of scar tissue that it creates. Even normal lipo or advanced lipo, power assisted liposuction, even if you don't use a laser, you're going to have some fibrous tissue, fibrosis that accumulates in your subcutaneous layer, which is right under the skin. So you're already going to have some scar tissue. So why add heat to produce more scar tissue? Then you have added risk of burning. I don't think it's horrible. It's just not my preferred method. I like to stay as natural as possible with less tissue trauma as possible. For me, liposuction is really like an art. It's fun. And so I think it's about gentle technique, minimizing tissue trauma, and approaching it the right way. Most procedures take about 1 to 2 hours, depending on how big you are, depending on how many sections I'm treating, but usually about 1 to 2 hours. I literally just finished Awake Lipo about less than 10 minutes ago. I finished up and just ran right up here and jumped on. Um, what is the recovery and downtime like? That's the good part. The recovery is super easy. It's not like a tummy tuck where you're going to be out of work for about 1 to 2 weeks before you can do desk work. With liposuction, I only tell them they need to be off 1 or 2 days. You'll still be sore, you'll still be swollen, but you can go back to desk work. And so the recovery is super easy. Um, you're going to swell the first week, it gets worse. And then it starts to subside. At 6 weeks, most of the swelling is gone, but not all of it. The rest lingers in your tissues for about 4 to 6 months. So, hope that answers your questions. Good question, by the way. The next question is, can a patient with a heart condition like congestive heart failure still get awake lipo? The short answer is yes, they can, but it depends on a lot of factors. That's why you go to board certified plastic surgeons who understand the human body, who understand medical conditions, the pathophysiology behind them. With congestive heart failure, your heart is not strong enough to contract. It builds up with fluid. It's typically enlarged. The fluid can get on your lungs. With liposuction, we would be very careful about fluid management. So we would not want to use too much tumescent fluid, which is the numbing fluid that we use for liposuction. That tumescent fluid, about 33% of it is going to be reabsorbed into the lymphatic system and eventually into your intravascular space and back to your heart. So, because of that, we do not want to use a lot of fluid. Someone with congestive heart failure, I would minimize it to maybe one or two areas. And then what we can do to stay safe is stage it. The beauty of this is that with congestive heart failure, it's more risky to get general anesthesia. So staying awake makes you safer with congestive heart failure. All right. So next question is, what can happen if a patient doesn't follow post-op instructions? Mm, that's a little bit like asking what can happen if your kid doesn't follow instructions in school. Like a lot can happen. It just depends. Um, if a patient doesn't follow post-op instructions, it depends on what particular instruction they don't follow. But in general, it can compromise your results. It can lead to complications. It depends on the procedure. Sometimes nothing can happen if they didn't follow your instructions, and some of the instructions are just preventative, prophylactic measures that we're just doing just to be extra safe that we don't really necessarily have to do. Other instructions are absolutely imperative that you do them. Let's take wearing a compression garment, for instance. Wearing a compression garment will help minimize your swelling. It'll help keep everything intact. It even helps keep pressure on your skin. If you have a little bit of loose skin, it's nice to keep it nice and compact. So, not wearing your compression garment, you're still going to heal. Your healing will just be prolonged a little bit. You could be a little more uncomfortable, and your skin may not be quite as good if you don't wear it. So, just depends on the um, the instruction. I'm gonna on a side note, I had patients when I first started training that never came for their follow-up, and they came back and they still had their steri strips on. And I was like, you still got these gross steri strips. So I took them off and the incision looked amazing. Um, and then I had several patients to do that. And I started to notice that there was a trend of their incisions looking better because typically we would take out the steri strip at the first follow-up. Um, and what I've learned thinking about how wound healing occurs, there are growth factors, important cytokines that support wound healing and nice scarring. And when we take the steri strip off too early, we pull that scab off underneath the steri strip, it comes off with it. So then I purposely started leaving the steri strip on longer. I did my own institutional study and we examined it. I used to take one half off on the patient and then, of course, with the patient's permission, one side I would leave it on, one side I would take it off. And the part that was left on the longest without replacing them with new clean steri strip looked better. So they didn't follow my instructions, but it worked out for them. And it also helped me learn something. This isn't alcohol, by the way. I just turned this light bulb, so I'm hydrating. So I know you guys see a red cup, but it's just me hydrating, no alcohol. I got a question that says, what is drainless method? What is a drainless method? Um, a drainless method is a method that we use where when we do a tummy tuck, we don't put in those drain tubes. Instead of using the drain tubes, we use what's called progressive tension sutures. And typically, when you do a tummy tuck, let's say you make an incision at the bottom of the belly, we lift that skin flap up, we pull it down and cut off the excess. And then we put that same skin flap back down on top of the muscle. This space between my hands, this space is the space where the drain tube would go, right in here, right in the middle of this sandwich. And so the drain tube collects the fluid until it heals. Instead of using a drain tube, we stitch this part of the skin, the undersurface of the skin, we stitch it down to the muscle, and we progressively pull it down closer to this incision. So by the time we close this little part down here, by the time we sew this, this is the line that goes across your waist. By the time we sew this line, there's no tension, there's no pressure on it. So you won't be as bent over as long. It keeps tension off of the scar. That's particularly important in ethnic patients. Tension is the enemy of great wound healing. So it keeps tension off of the scar. You're not as bent over, not as much lower back pain, and you don't need the drain tubes. I started doing it years ago for a long time because I had a lot of out-of-state patients and they couldn't come back to have their drains removed. So when I first started doing it, quite honestly, I was still getting seromas and fluid collections. And it was because I was developing the technique. I was doing it the way it was described when it was published in the Plastic and Reconstructive Surgery Journal by a group out of Dallas. It was first described in 2002 in the Plastic and Reconstructive Surgery Journal, and everyone was using that method. We really couldn't quite figure it out. After doing about, I would say 60 cases, I came up with my own way of doing it. Not that their way didn't work, it just didn't work for me because I also did a lot of lipo, probably more than other people did, and in a different way than other people do it. So that was disrupting my progressive tension sutures. So through trial and error, I figured out a way to do the progressive tension sutures, do the lipo the way I want to do it, and not get fluid collections. And so it prevents seromas, hematomas. It kind of helps, but I have better results. And according to the most recent literature, your fluid rate is going to be less with the progressive tension sutures. And I've had buddies of mine that we're sitting around discussing it, and they'll say, "Well, progressive tension sutures, that doesn't work. That's just advertising. It doesn't work." And I'll tell them it absolutely worked. I do it multiple times every week. I literally haven't used drain tubes in about 8 years. Like I don't use drains, and I get seromas or fluid collections when I do lipo, just lipo, more often than when I do a tummy tuck with the progressive tension sutures because it works so incredibly well. Good question. Hi, Elizabeth Simpson. Elizabeth Simpson. Okay. It says, "Hello, Dr. Jones. If you've had a tummy tuck and your stomach is still not flat and you have fatty tissue around your organs, will liposuction make your stomach flat?" Okay, good question. The answer is no, it will not, because if you have fatty tissue around your organs, the fat accumulation pushes out on your belly the same way that a baby does. Oh, special interruption. We got timeout with the live Q&A. We interrupt this program to bring you a special guest. Oh, you can sit right here. We interrupt this program. I'm going to give you guys 30 seconds to guess about my special guest here. I'll give you some hints. She could be anything. She could be a consultant for the practice. She could be a relative coming to visit me. She could be a new plastic surgeon. She could be a nurse. She could be our new masseuse. She could be anything. So 30 seconds. Pop your. This is a little game we can play real quick. I want you guys to guess why she's here. We'll take about 30 seconds. I'm interested to see what people say. Nobody's responding. They're like, "I don't know, just tell us." Okay. I don't see any responses. I guess you guys don't care. Okay. Oh, Barbara, good guess. Consultant. That's a little cold. To assist in answering questions. Oh, I wish. She probably could help me answer questions. Follow-up. Piper, you're getting warmer. She had surgery before, even warmer. Singer, can you sing?
No.
Okay. She's not a singer. She's a consultant we met with before we meet with you. No, that would be Alana, but Ariana. Oh, Ariana would be happy to hear that. It's not Ariana. This is fun. All right, all right. Okay, let me put you out of your misery. Um, you want to tell them, or you want me to tell them?
I can say it. I am actually a patient, Dr. Wright Jones, and I just completed a weight abdominal lipoplasty.
Like, yeah, it's technically it is called lipoplasty,
Mhm.
but she just had a weight liposuction, and we finished about 15 minutes ago. Right as I came in here, we just finished. Um, someone said I knew it. And, oh, I ain't gonna say who the name is, but I know the person who just said that. You should have said it. But and the person who just said that, hey, we miss you. But So she just finished liposuction. She had liposuction awake, right?
Mm-hmm.
Upper, lower abdomen, and her waist, all just completed. Um, so anyone have any impromptu questions for her? She just literally just finished. Um, I will tell you, she was a little nervous, right?
Mm-hmm.
Just the thought of being awake scares people. Um, someone said she's the one that made you late today. No, but one thing that we do not do, especially me, I do not rush surgery for nothing, not even for myself. I miss trips, I miss plane rides, I miss everything all the time. We do not rush surgery. If you're on the table, you're my number one priority in life, period. Um, so we don't rush surgery, but she didn't make us late. I actually had her surgery was a little bit delayed because I have a patient who's very sweet, amazing patient, flew into surgery from Illinois, had her follow up, and she had some logistical issues. So she got here late, and I couldn't um, start because I wouldn't have been able to see her, and I knew it was going to overlap with this. So that's why we're late. How was the results? Was it major? Um, let's see. Someone's asking about your results. Oh, she saw it. What do you think?
Uh, my results look great just off the initial view. So I'm really excited to see once I go through the recovery process and get into a true healing phase to see what the final results will be.
Um, so right now, she's not as swollen because we just finished. Her body hasn't reacted yet. We took off about just over a liter and a half of fat. She's not very big. She already had a good body, good skin, elasticity. So she was a perfect candidate for this. Oh, someone just commented, hello. You can read these questions,
Mm-hmm.
right? Someone just said, had a weight lipo with you a few weeks ago, and it looks amazing to me. Thank you very much. You're awesome. Everyone misses you. I just text Anna and asked her for her before and after, so she sent them to me. This was you before. This is after. So her before is just her marked. You can't really see much. It's just her laying on the table. I had to adjust my lines for symmetry. Here's her after result. It's kind of taken at an angle, but you can see it looks very natural. Her abdomen looks toned. Her waist came in really well. We took out half a liter of fat from each side of your waist.
Okay.
So we got a lot of fat out. She was kind of just not asleep, but your eyes were closed.
I was definitely comfortable. If I was to stay a little bit longer, I probably would have fallen asleep.
Yeah, she did great. Um, Someone just says, congratulations on your procedure. Looks toned and amazing.
Thank you. Thank you.
I'm excited for her. She's going to do great. Um, well, so like most people, she was nervous, and I kind of like sometimes I have to work on my approach, and I've been evolving my approach over the years because I used to sit there and over explain,
Mm-hmm.
and I noticed the more I'm delaying it, the more the nerves build up. Now I like to try to calm you down and then just get you in there and do it. And that's what we did. So she got it over with. On a scale of 1 to 10, how easy or difficult would you say it was? With 1 being extremely difficult, 10 being a breeze. Like where would you put it? Honestly, it's
10,
okay.
10 plus. The only thing that was discomfortable was the initial numbing aspect of it. Other than that, you'll just feel a little pressure. You can hear the vibration, but not hurtful or painful at all.
Yeah, she did good. Okay, I'm excited to see you two who just commented. All right, so thank you for joining us, popping in. We need to let her go. She just had lipo. We told her to stay hydrated, something with electrolytes. She has her source here. She's already started hydrating. And she has a compression garment on. She has some pads underneath. And yeah, she just walked up here. This is the power of awake liposuction. You're seeing it, right?
Yeah.
Like if she would have had general anesthesia, you would not be up here sitting like you didn't have surgery.
Right.
You know? So it's crazy. I had one patient who coincidentally came for follow-up today, and she had a breast implant exchange and a left revision because her breasts were kind of messed up. She had that awake, and she told me that she went across the street to Chick-fil-A afterwards and something was wrong with her order, and she went inside to address it, and she thought to herself, wait, I just had surgery. I just had my implants exchanged, and now I'm in Chick-fil-A talking about my meal. So it's very powerful. It's safe. That particular patient had severe diabetes, and the surgery centers would not clear her for surgery. And I don't want to put you at risk either. So we came up with a safer way to do the procedure.
Yeah, for me, I started cutting out a lot of sodium and being very mindful of my diet weeks prior to it. So it could be a little bit more of a habit for my recovery process.
Mm-hmm. Yeah, she's been great. She's also works in healthcare, so it's always an honor to have someone in healthcare come. But yeah, we don't want to hold you up. Okay. So thank you for joining us.
You're more than welcome.
Let us get someone. I still don't like for patients to walk around without assistance. Mm-hmm. Sometimes losing so much fat so quickly, you can have a vasovagal response. You can get a little lightheaded. You can have fluid shifts, electrolyte changes. So we keep the patients in the office for a little while, mm-hmm. just to keep an eye on you, make sure you're okay. If you're only having one area or two small areas, and we're removing like less than a liter of fat, a small amount, then we have patients drive. They drive themselves. She had some medications. When you drive yourselves, we don't allow you to take narcotics and Xanax and get behind a wheel. So if you're going to drive, we just numb you up, and they don't take any medications. Like you can probably imagine, had you not had that, you could easily drive home.
Yeah.
But I still wouldn't recommend it because of how much fat you have removed.
Right.
But people who have, let's say, you had your upper, lower abdomen and your waist, mm-hmm. but some people just only have their waist or only their upper abdomen. Usually they had a tummy tuck and they just want their upper abdomen. We remove like 400 or 500 cc's of fat. And in less than an hour, they're like, see you guys. And they're just driving home. And they don't have to go through the hassle of getting an assistant to take mm-hmm. off and come pick them up in the middle of the day. They can just take care of themselves. and it's easy. Is it easier than you thought it was going to be? About the same what you researched, or what? How was it?
So my research was definitely kind of, I heard a lot of good things, that it wasn't going to be hurtful or anything like that. And then at the same time, I've heard other people say it was excruciating pain immediately. Me personally, I think it was a breeze. Like I said, again, the numbing part of it was a little uncomfortable, but overall, it was just a little pressure, but no pain.
Okay, let me have someone come and assist you. They just ditched you. I guess they thought you were going to stay in here. Okay, so someone just come in. I just want to say you're such an amazing doctor. Oh, thank you. The work create beautiful body for me. Oh, this is. Oh, I know who this is. I'm so sorry. I know who you are. So it's a patient commenting. And you see what she's saying. She's just thanking me for her work. She recommends me for anyone who's wanting to have cosmetics on their body, and I'm truly God sent. Thank you. That means the world because I feel like God works through me. I don't take the credit. Sometimes I literally feel this is maybe too religious for some people. But I literally feel the Holy Spirit. Even with yours, just now I felt it, and I don't always feel it. I always know it's present, um, but I really felt it. Her procedure was less than 2 hours. It was about an hour and a half, and we got a lot of fat out. We did it safely, and yeah. So we need to let her get home. Thank you so much for joining us.
Appreciate it. And I'll see you next week for the pre-op.
Yeah, so she'll come for her 1 week follow up.
I mean, I said pre-op, yes, post-op, yes.
Yep.
All
All right.
Thank you. And if anyone is straddling the fence, do it. Just go ahead and jump over and make the decision and go for it.
All right.
All righty.
Thank you.
Thank you.
Take care. All right, we can get back to our questions. You can leave it open. Thank you. Someone asked, do you think you would ever do awake fat transfer to the buttocks? I do think I would do it because I've done it a lot. I just don't like to do it. The reason I don't like to do it is because sometimes it can be a little more painful, and numbing the buttocks, I like to numb it. Some people don't. You absolutely should, in my opinion. Numbing the buttocks, we're adding volume, and the fluid makes it expand. You can't quite tell exactly how much fat you're putting in, but I've done it a lot, and it's always gone well. It's just not my favorite thing to do because when you are asleep, I can just kind of just do it. And some people have hip dips where the skin is in on the hip, and we're trying to like get it to pop out by doing the fat transfer, and then we're pressing on the butt. And I'm putting the cannula close to the skin sometimes. If I feel a band, I try to break the bands up, and that can be a little bit painful. You can do it. I just feel like it can be done better with you asleep. But yes, I've done it a lot. A few of those patients were my staff members, and they were like, "Just do it, just do it on me." And I've done it. I had a celebrity patient who was supposed to go in the OR, but the schedule wasn't working, and so she just asked me over and over to do it awake. I did her fat transfer awake. She did great. Still don't like it. I don't know. Maybe I'm stubborn. I don't like it. So, what is the healing time and recommended time off for blepharoplasty? So, a blepharoplasty is an eyelid lift. We can do upper blepharoplasties, lower blepharoplasties. The healing time, the body just takes its time to heal no matter what area of the body you're operating on. Typically, the first week, you have this inflammatory cytokine surge in your body that causes swelling, causes soreness. And that's no matter where you're cut or injured. Surgery is really a controlled injury. It's an injury that we do on purpose in a controlled manner to make you look a certain way. So when it comes to blephs, it still takes about 10 days for that initial swelling. You'll have bruising, and after 10 days, the swelling goes down. So at 6 weeks, a lot of the swelling is gone. And I tell people it takes about 4 to 6 months to see the final result. I love doing blephs, by the way, because I think they're very powerful in terms of rejuvenating the face. If you next to a facelift, I think it's one of the most powerful things you can do. In African American or higher Fitzpatrick skin type patients, um, when you get bruising and ecchymosis or bruising, it settles in your eyes. And so what's black and blue, it goes away. But the residual products of the red blood cells, we call it hemosiderin, it's a byproduct of red blood cells. So once it breaks down, that pigment shows as a dark hue under your eyes. So when I do blephs, I try to minimize any bleeding. I'm very meticulous. I take not a long time, but I just don't rush. I like to really take my time. There was a famous plastic surgeon from Emory that I learned blephs from, and we used to laugh because he would take so long to do it. Now I totally get it because it's just about being meticulous. It's a small space, but it's very intricate. There's a lot of important structures that we have to avoid, some we have to release. And as we're doing that, we want no bleeding. I don't want a drop of blood if I can help it. So the recommended time off of work just depends on your job. Some people just put on shades. I've had people go back the next day if they had a bleph and they just put on shades. Um, Depends on what you do. But you'll have black eyes for about 7 to 10 days. And then that goes away. So you can go back to work the next day. It's not something that causes a lot of pain. Someone asked me, can I have a breast augmentation and tummy tuck in the same procedure? Does the tummy tuck also include lipo 360? Interesting. And I'll tell you why it's interesting. Yeah, you can absolutely have a breast augmentation and a tummy tuck in the same procedure. That's easy. That's something we do every day, all day long. It's become pretty standard to these combo cases. And then the tummy tucks here almost always, I would say 95% of the time, includes lipo of your waist and your back. So you asked me about, does it also include lipo 360? It includes your waist and your back. We're doing a tummy tuck, but I don't lipo your belly here because your blood supply, we cut it at the bottom, and the remaining vessels come under your skin. They come from under your ribs. We call them the subcostal vessels. They're the main blood supply. The perforators that comes off of the vessels underneath your abdominal wall that normally keeps that skin alive, we sever those as we're elevating that skin flap. We cut underneath the skin flap to elevate it. So all of the little blood vessels that were coming into it to feed it, we sever them. And so the blood supply, when the skin is elevated, the blood supply, see where it's attached right here? That's the only blood supply. This is kind of floating in the air. So if I lipo up here where it's attached, that can knock off your remaining blood flow and make your skin die. So technically it's not lipo 360. It may look like lipo 360, but lipo 360 means circumferentially including your abdomen. I like to stay a little bit safer, and so I don't lipo the abdomen. Sometimes I do, like very little, but I try not to lipo the abdomen when I'm doing a tummy tuck. I lipo the waist and the back, and that decreases your complication rate. All right, do we have any other questions? Okay. Recovery time to remove eye bags. So I just had that question a few minutes ago, and so I'll say what I said then is um, the recovery time is minimal. A blepharoplasty should not affect your vision. Sometimes you can have what we call chemosis, which is basically edema of your sclera around your eye, and that can cause a little blurry vision, usually not. Um, Dry eyes can be irritating, but typically your vision is not infected. Your vision is not affected, and it doesn't affect your eyesight, and the pain is very minimal. So a blepharoplasty is not debilitating. A blepharoplasty, by the way, is an eyelid lift. So doing your eyelids is easy. It's a small area. There's not a lot of pain. So everything depends on your job. Um, if you're a model, it may take you a little longer. If you're anybody else, you'll have black and blue eyes for 7 to 10 days. So if you don't want to walk around with black eyes, you could wear shades. If your job allows you to do that, you could go right back. So the downtime is very minimal for a blep, but I tell patients about a week. All right, next question. Is there a specific diet or exercise routine patients should follow after lipo or a tummy tuck? The diet is important, but not as important as the surgery. So, what I mean by that is there are so many things you can do to theoretically help, but some of those don't necessarily move the needle in your recovery in a big way. The main thing that really affects your healing in terms of diet is salt. So right after surgery, if you consume a high amount of sodium, your body will swell. Some people will literally feel tingling in the areas where they've had surgery from salt. So I tell patients to have a low salt diet. Do you want to take? Can you take turmeric? Yeah. Green tea? Yes. All of those anti-inflammatory things. Well, we have our patients doing arnica and bromelain herbal medications. Um, but the main thing, obviously, you don't want to eat a lot of fried foods, and you want to minimize your salt intake. In terms of maintaining your result long term, you don't have to become a health nut. You could just be normal. If you just, because some people, I hear this thing people saying about, oh, you have to maintain your results. You got to eat right. You got to do this. Yes, you do. But if you just eat like a normal person, your results are generally pretty stable. So it's not like you have to become super healthy or have a really strict diet after your surgery. Surgery is just not a free pass to eat and do whatever you want. Just you still got to be normal and mindful of what you should eat. You should do that anyway for health reasons and cardiovascular risk. Um, so exercise routines, most we limit exercising the first 6 weeks, and then after 6 weeks you can gradually start back exercising. If you had a tummy tuck, we do a muscle plication, and what that is we bring the separation of the rectus muscles back together, so that tightens your abdominal wall. And we don't want any core exercises the first 3 months with the tummy tuck. With liposuction, after 6 weeks, you can do whatever you want. So exercise routine is light activities. We want you walking the first week, even the first day after surgery. We want you walking every 2 hours, at least 2 to 3 minutes. We don't want you overdoing it, but we do want you walking. Um, just for 2 to 3 minutes. If you do too much, then you're getting up and down, you're moving, and you're irritating your body, and you're in that inflammatory phase still, and you're irritating the tissues by moving too much. Because some people think they're helping, but all they're doing is causing more tissue trauma and not allowing your body to heal the way it should. Okay. Are lymphatic massages necessary after an extensive tummy tuck? The short answer is no. But do they help? Yes. Because we do the drainless technique, our lymphatic massages, remember the skin is tacked down to the muscles. You have dissolvable stitches underneath. We don't want someone coming massaging on it and doing this, and because that can break the stitches and cause a dead space. It can dislodge the sutures. The sutures are dissolvable, and so we want the no massaging on the abdomen for the first 4 to 6 weeks. Keep in mind, we're doing follow-ups, we're keeping an eye on you, so we'll clear you when you're ready. Massaging of the waist and the back, those are okay, but not your abdomen because of the drainless technique. And after this, that was tummy tuck, but with liposuction, we want lymphatic massaging to start the post-op day one, the very next day. We want to get all of that fluid out of your tissues. There was a study done that looked at drain tubes and the content of the liquid accumulated in that drain tube. And they studied looking at inflammatory cytokines and interleukin 1, TNF alpha. All of these inflammatory cytokines were noted to be increased within the fluid that accumulated in the drain. So, what that tells us is that the fluid is not just fluid that sits there and creates this fluid wave and bulk in your abdomen. It's also metabolically active fluid. So those inflammatory cytokines can cause a little more irritation and a little more scarring. Because of that, after your liposuction, we want to get as much fluid out. We want to get as much out as possible. The patient you guys saw earlier, she's coming in for a massage tomorrow. Next question is it true that fat does not return to the areas that have undergone liposuction? That is such a great question. So the short answer is yes, it is true. However, when we do liposuction, we don't remove all of your fat. So in an adult human, fat is stored in compartments called lobules. So usually when you're unhealthy, those compartmentalized segments of lobules, they store energy. And if your energy, if you're consuming a lot of calories and your intake is high, but your output burning those calories is low, those lobules grow, they expand, they get bigger. So lobules have the fat cells, adipocytes within them, and they expand. So when you lose weight, they tend to shrink, but they're still there. They expand and shrink. And what happens is, let's say you just love Popeyes and you're eating all this chicken, and they'll expand, 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 and all of a sudden, boop, another one is created, and that one starts expanding. That's how fat evolution works. So with liposuction, keeping that in mind, because this also applies to the question that people ask, does it move to another area? So with liposuction, we lipo the fatty area, it gets smaller and smaller. We always leave a cushion of fat underneath the skin. The blood supply to the skin is in this fat. That's why you can get lipo burns if you're too close to the surface. It's really ischemia. So the blood supply to the skin is in here. So we want to leave a little layer of fat. And it also makes us look natural after lipo. Like my patient who just left, she'll be able to put on a bikini and no one would say, "Ooh, look at her lipo." Like they won't have a clue. Um, but sometimes you can tell when someone's had lipo because it's a little uneven. You can see little divots here and there. The way we avoid that is by leaving a smooth layer of fat under the skin. So it's like laying in the bed and you're under a sheet. You can see every nook and cranny, but if you're under a thick comforter, you can't really see all of the topography underneath. But with lipo, the tracks of the cannula, if you get too thin, you start to see every direction that cannula has gone, and it looks uneven. So that fat, you asked, so the question was a long answer. Is it true that fat does not return to the areas that have undergone liposuction? So I said it's true because when we lipo, the fat cells that we take out, they're gone forever. They're gone. The fat is not coming back. But the fat left behind can still expand. It can still spread or hypertrophy those lobules. Also, you can still grow new fat cells. For the most part, the number of fat cells are stable, but if you're just extra unhealthy, eventually another one will pop up and that one will start expanding. So the fat left behind can expand, but the fat removed is gone forever. The significance of that is that um, if you start eating a lot or being unhealthy, let's say you did your abdomen, but you didn't do your thighs, you'll notice your thighs getting bigger. And the rest of your body, your thighs, your arms, every area of your body that did not have the lipo will get bigger. And it's getting bigger because it would have normally gotten bigger. If you eat like that, you're going to get bigger. Your belly will not get as big as easily because you have fewer fat cells left to expand. That's why people think that the fat moves to another area. It's not really moving, it's just that you're still getting fatter. And this area is not because there are fewer fat cells to expand, if that makes sense. So now you understand why I had to answer it that way, because it's not a straightforward answer. You have to understand why. So I just want to remind people, I like to do fun stuff. To me, live music is fun. We started Lyric Music Lounge. We have a new VIP consultation experience. To me, it's the ultimate consultation where imagine a consultation in an amazing space with incredible talent singing. And if you like live music and you like going out to a music lounge, you can go, you can hear music, you can enjoy it, and you can get a consultation for surgery. So we call that our ultimate VIP consultation experience. And our next one is August 29th. It's going to be located in our office. It's a lot of fun. Um, um, my associate, she hates for me to say this, but we do have cocktails. I said it. We have cocktails. We have food, and we prefer you not have anything to drink before your consultation or signing any paperwork or deciding if you want to get surgery. You want your mind clear, but it's kind of a party. We like to have fun too. What better way to enjoy life than to do what you love and have fun and change lives and help all of these women feel like they're their best selves. So that's what we do. Lyric Music Lounge, August 29th. Any more questions? Okay, I got another one. What does a mummy makeover or tummy tuck typically cost? I wish Alana was here. And are there payment plans and financing available? I should know the answer better than I do, but I do know for the most part. So tummy tucks and mummy makeovers vary. People can never get straightforward answers, and I don't like that. Like you call a place, like just tell me. Um, but I can't say. I'm gonna get in trouble for saying this because I really don't know the prices. I help set the prices in the beginning, but I try not to get caught up in finances and money because I know if I do my best and do what I'm supposed to do, the money's gonna come. So I just I don't memorize stuff, but I think it's around the tummy tuck 22,000. I think somewhere in there. But we do different types of tummy tuck, so it depends on if you get an extended that's a little bit longer. Um, but a standard tummy tuck is what it is. Everybody is different. Thank you, person who just said that, who's a former patient. And this former patient just commented. She said, "Remember, you get what you pay for." That's true, but it does vary. Like it's not. It's like asking a car dealership, "How much are your red cars? Do you want an SUV? Do you want a compact car?" It varies. Um, so someone just commented, some surgeons do Mons plasty. What are your thoughts on that? And is it included in the tummy tuck procedure? So that depends. So this, this is why AI has a lot of limitations. This is why people who do their research cannot really get a straight answer, even though they think they're getting straight answers. So a monsplasty is also called a puboplasty. And what that is when we lift the pubic area up, sometimes right in front of your pubic bone, that tissue can become lax and it can sag and droop, even down into your labia. Um, so with a puboplasty, we lift it up and we cut off some of the excess skin and tighten that area up. So with a tummy tuck, there's varying degrees of things that are done. So I would say that a puboplasty is done with every tummy tuck. So we always tighten it up some. I don't consider that a dedicated puboplasty because I have done official puboplasties, but those are usually like massive weight loss patients. They have a lot of ptosis or drooping of their mons. And when I do that, I lift the mons this way. So I lift it up and I bring it up and I cut it. And I also tack it down the same way we do the abdominal flap with the drainless stitches. I tack it down so it doesn't drop back and it eliminates dead space. So if you need it, officially need it, we will tell you that in your consultation. But so in every tummy tuck that I do, that area is tightened. If that answers your question. Got you. So we got about 8 minutes left. Um, any other questions? Someone said they're having a weight liposuction by me in a few weeks. How long will my two areas take? They're doing their flanks and their upper abdomen. That will take about an hour and a half. It's just two areas. It also depends on how big you are. Um, Trying to think of an analogy. Let's say you're getting your hair done, you know, and you're getting braids. So it depends on like how many braids, the type. But usually, upper abdomen and flanks will take about an hour and a half. I don't have a time limit on surgery. I tell my staff and my assistants that we have three priorities. The first one is safety. I don't even talk about safety because that's a given, but safety is number one. Um, the second thing is quality. Um, we always focus on quality. And the third thing is speed. We do want to be fast. So, but we don't compromise speed for quality or safety. So sometimes I go over all the time, but for me, it takes as long as it takes. If we don't like a stitch, or if I see some lipo still needs to be done, I'll do more lipo. I'll replace that stitch. We do whatever it takes because it's really about the quality and the safety. But I do like the speed. You know, no one wants to be on in surgery longer than they need to, longer than they need to be. Oh, and you're having a weight lipo in 2 weeks. I can't wait. It's gonna be fun. I can't wait to shock you. Anything else? Okay. How old How old are I too old to get a BBL? So I think you're asking how old is too old to get a BBL? It really depends on how healthy you are. We have some 60-year-olds who are healthier than some 30-year-olds. So the age cutoff we have for body contouring is around 60. So I've had patients 62 because they're really healthy and they can get a BBL. And keep in mind, a BBL is also about your skin. Um, the older you get, the more elasticity loss you have in your buttocks. So at a certain point, if you have a lot of loose skin, you may not do quite as well with a BBL. It can be improved, but maybe not ideal. So really, I would say up to around 60, you're okay to get a BBL. We have patients in their 50s asking me, are they too old? That's nothing. Like, you should see all the hot 50-year-old patients we have walking around here looking better than 20s and 30-year-old women. Have you ever had a patient to experience nerve damage after extended tummy tuck? The answer to that is yes, um, but it's typically short-lived. Um, and the nerve damage. So with a tummy tuck, the scar goes like hip to hip, and so when we cut here, there's a nerve here. It comes in about here. There's a nerve called the lateral femoral cutaneous nerve, and it's pretty superficial. It's in the area of the tummy tuck, and sometimes it could be irritated by the surgery, and you'll feel um, some numbness on your thigh and along the side of your thigh. And that typically resolves in about within the first 6 months, but usually it resolves in 6 weeks. So that's the kind of nerve damage I've seen. There's not a lot of major nerves in the vicinity of a tummy tuck. So from that perspective, it's very safe. Someone asked if you get neck tightening, can you do it while awake? And how long for recovery? If you when you say neck tightening, if you mean a neck lift, yes, you can do it awake. If you need only a small amount reduced or tightened, um, and a small amount of skin reduced, then you can do that awake. For most people, they need to be asleep because they need more than what they think they need. Um, but neck tightening, we also have non-invasive skin tightening devices that we use on the neck, and that's a med spa procedure. And you don't have to. You can be awake. We numb it up with some cream that goes on your skin, and it numbs your skin and tightens it. But for a full neck lift, you need to be asleep. For a mini small amount of skin tightening for your neck, you can be awake. Someone said, "Thank you for your time. You're welcome." Actually, this was fun. I like the spur of the moment questions that you guys can tell aren't rehearsed. I'm big on authenticity. I'm also, I've gotten in trouble for being too honest. And when I say in trouble, I've offended people, not on purpose. I just learned when you blur the lines, patients hear what they want to hear. So I like to be very clear on what we can and cannot do. We don't just tell you a dream to get you to sign up for surgery and take your money. We want you to know exactly what you're getting. We want it to be worth it for you. So thank you guys for joining. This was fun. We're going to start doing this more often. Can you guys reply and let me know if this was helpful? Would you want more of this? Because if you don't, it's not helpful. I'm definitely not going to keep doing it. But if you guys like it and you think it's helpful, let us know, and and I will continue to do this. All right. Thank you for joining us, and I hope to see you at Lyric Music Lounge. Come meet us in person, get to check out the facility, get to learn more, get your ultimate VIP experience on August 29th. That's right around the corner. All right. Someone just says, I'll say this. Oh, hi. She's 3 weeks post op from my tummy tuck. Thanks, Dr. Jones. Heart, 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 and this. Okay. Yeah. You're welcome. Can't wait to see you for your 1 month follow up, and looking forward to your progress. All right. Thank you, Kiki. We'll continue to do this. Definitely more of this. All right. Everyone have a good evening. Stay blessed and stay safe.